After I learned about MMP9, I could fix that. The next one was VEGF, vascular endothelial growth factor. This is a compound that's released in response to capillary hypoperfusion induced by cytokines. You reduce tissue delivery of oxygen, VEGF will rise. VEGF will bring forth greater delivery of oxygen and production of new blood vessels. Now, if we leap to cancer for a minute, cancer cells are obligate consumers of sugar, and they need a lot of blood flow. If VEGF is driving the cancer by feeding more blood and more blood vessels, would it be a good idea to knock out VEGF in those patients? And if we look at one of the big deals in treatment for colon cancer and cancers metastatic to liver, VEGF inhibitors are key in cancer therapy for them. Now, the problem with that is that when we look at VEGF, which is number 61 on your physician packet, you will see that low VEGF is quite common in biotoxin patients. They've got capillary hypoperfusion, but they're not delivering adequate oxygen when they should be. And that was always a concern. Why is that the case? Because they're functionally acting like they're being exposed to a cancer chemotherapeutic agent. And it bothered me to no end until I read a book written by Jonah Falkman out of Children's in Boston. In his work as father of the anti-angiogenesis movement, he was the pioneer of saying stop blood flow to cancers. And much like we had with the penicillin story, with somebody leaving a petri dish open overnight, Falkman had a petri dish with endothelial cells that were growing rapidly in his tissue analysis, and somebody left the lid off. And he comes back the next day and looks at these cells. They've all got ruffled edges. They stop growing. Something on that plate was stopping growth of these cells. And he found it. It was a compound named fumagillin. Fumagillin is made by Aspergillus fumigatus. And if we have a fungal compound that's knocking out angiogenic movement, is it doing so by knocking out VEGF? Interesting question. Falkman didn't answer that, but that's still part of the question as well. VEGF is fixable by use of lactose and the no amylose diet for people that can't take lactose because they get funny feelings of weak, woozy, and wobbly, or if they get the feeling like their blood sugar is falling low. It won't be low, but they'll feel that way. You can, or if they're very slender and their leptin is less than 7, remember, lactose lowers leptin, you will use omega-3 fatty acids, the fish oils, in fairly high doses, 2.4 grams of EPA, 1.8 grams of DHA a day. I worry about people taking that much fish oil. In my practice anyway, that's a good slug. And I was especially worried when some people started swimming upstream and spawning. It was really a drag.